All right. Welcome for the new topics. Today we are still in for medical framework. So today we are looking at medical negligence. We talk about medical negligence, the importance of negligence and the causes of negligence in the hospitals or between the patients and the service providers, and also how best as such all these illegalities can really be managed such that the clients can continue to receive effective and reliable services at all times. So what do we mean by the term medical negligence? And we are saying that medical negligence is an act or omission. An act or omission. Omissions would mean failure to act. Or at times you can actually act, but then you act wrongly. It still becomes omission. So it is an act or omissions by medical professionals that deviates from the accepted medical standards of care. So the likes of the patient's abuse and other characteristics or the characters that personnel are involved in can be regarded as medical negligence. So we have the like of patient's abuse that can also be regarded as medical negligence. This is any actions or failure to act which causes unreasonable sufferings, miseries, or or harm to the patients. So any things that you do to the patients, it can be an abuse. It can be like using words you can actually insult, but as long as it causes harms. And remember, because these kind of harms, some of them may not actually be physical, but it may be emotional. The like of, for example, sexual harassment, the like of physical harm, where the patients will experience or bears an hurt or wound on the physical body. All these can be regarded as patient's abuse or negligence, the like of psychological abuse and the rest. So the abuse include physical striking or sexually assaulting a patient. It also include the intentional withholding of patient food, physical care, and medical attentions. So even when you say that you're not going to eat food because of the reason that maybe such action is actually negligence. Is a negligence. So it can happen at home. That would be regarded as parental negligence or maybe family negligence. But when it happens in the facility where you refuse a patient from eating food, that is definitely medical negligence. So even also failure to properly attend to the patient's needs and caring of patients, this can be intentional or may be unintentional. Regardless of such, whether mistakes or not a mistake, intentional or non-intentional, such all is considered as medical negligence and needed to be addressed always. So let's look at the types of patient's negligence. The types of patient negligence. So we have so many ways that a patient can be neglected, and of course one of the types of patient negligence or patient abuse is physical abuse. And we are saying that physical abuse is any non-accidental use of force against senior citizens or a patient that results in injury, pain, impairment, or death. Impairment can include like loss of the body parts, if I may be precise. Loss of body parts, including even the tooth and all that, or even causing the death of the patient. This is physical abuse. It is the easiest types of elders abuse to spot. However, that is not only the case of relative visit the facility often or get frequent or detailed medical reports from the physicians. So, for example, we have unnecessary use of restraints or confinement, assault, and battery. So the battery is basically an action which is under the law, where, for example, you denied someone basically from accessing what they have full autonomy to access or use. Using force to assist patients or dropping a patient onto the bed or onto the floor, those are abuse. Hitting or biting, scratching, hair pulling, deliberate or inappropriate use of drugs, breaking bones, or any act of violence directed towards the elderly or maybe the patients that end up causing physical harms. All these can be regarded as physical harms. We have quite large of the examples. So number 2, we have psychological abuse. Psychological abuse is often a substance, and when we talk about substance, we mean something difficult to detect, or variably hard to detect, because nursing homes residents rarely talks about it or report it. However, it is more common than physical abuse and can be perpetrated by staff or fellow residents. So we have this psychological, because basically when a person is going through psychological problem, it is never easy to understand. In most cases, such conditions is ignored and forgotten. You get a point? So psychological abuse may not really be detected easily and may not be really understood by many people, even the services, the people who are providing the services. So it encompasses any psychological distress or emotional pain inflicted by the caregiver or fellow resident, and includes, for example, threatening or intimidating patients, terrorizing patients, menacing patients so they fear for their safety, making the elderly, for example, like asking funny questions to the patients, and then also probably humiliating and radically or demanding, demeaning patients. This is simply like undermining, disrespecting, blaming patients, and scapegoating or making the elderly or a patient feel guilty for needing care. In most cases, the patients will need certain care, but again, after them demanding for such care, you propagate and definitely make them feel like it was wrong for them to ask for such services. That is a problem. It causes them psychological problems, and that is regarded as psychological abuse. So medical negligence is basically one of the common challenges that we do really get in the facility and among the staff and the service providers. But of course, when it comes to the lack of psychological abuse, that will be difficult or quite connoting, basically, among the nursing homes and facilities to really understand, manage them, and also detect them at the same time. So that means such may need critical observations within the facility by different monitoring and evaluation teams. So we are saying that example of medical negligence include prolonged deprivations of water and food, lack of care for medical conditions, lengthy periods without patient supervisions, failure to provide medication on time, failure to monitor or aid patients with nutrition, medicating patients with anti-sclerotic drugs, those drugs that probably they can either cause a loss of mindsets, loss of concentrations, and end up causing a patient's kinds of complications that really disregarded them and make them probably weak. This can be done either intentionally or maybe unintentionally. So we have so many examples, and of course moving forward we have number 3, sexual abuse. So we are saying that sexual abuse is any contact of a sexual nature with an elderly patient without their person's consent. So when you talk about an elderly patient, we are actually not referring to someone who is an elder, but we're referring to a person who is above 18. How is it considered? This person is considered basing on the consent qualities or characteristics. What do we mean by that? It is that a person has gotten into an age that they can make their own decision, they have the capacity, they have the potential that is required for them to make their own to make their own decision. So such a person is now regarded as an elder. Now we are saying that these types of abuse can involve sex act, rape, forcing a patient to watch sex movies or pornography, or maybe forcing an elderly person to undress themselves. And it can as well be psychologically harmful. It can as well be physically damaging, to the citizens or maybe their patients. And the next we have financial abuse and exploitations. This is, for example, when a person is having complications like Alzheimer's or maybe dementia, and the person becomes vulnerable, especially when it comes to thinking, because a person who is having Alzheimer's, that means a person experiences a loss of memories that may last for long. Also, the one who is experiencing dementia, it will also have such kind of problems that will definitely last for long. So that means they will have problems in dealing with mental tasks, like making decisions, So if you take advantage of this, for example, let's say you have a person who cannot remember anything, is weak, is demented, and then you want to activate or maybe send money, and then you end up sending money to your own, or maybe you take advantage of their conditions and uses something that's supposed to be used by them, or in whatever ways causing them psychological or physical harm. This is regarded, but highly it is falling under the use of money, for example. So this would be, for example, trying to use stealing a PIN number or a bank account details of an elderly person or a person who have such conditions, and then withdrawing money from their account. Taking advantage of their conditions to really do what you would wish to do to them. So, for example, we are talking about unauthorized use of an elderly person checks, credit cards or account, stealing of their cards, checks or items of value, forging their signature, engaging into identity theft of such people. That is when you use their informations and then you impersonate to be someone, to be them, and yet you are not. But because they are actually having such conditions, Alzheimer's, and probably they're having dementia, it means they cannot be able to defend themselves and understand what is happening. Next example also includes coercing or convincing an elderly person to give a caregiver access to credit cards or a bank account. So all those are regarded as example of physical and exploitations, negligence. Now the question is, what are the major causes of some of these negligence? Going straight to the point, we have number one, miscommunications, or maybe definitely when we have miscommunications among the healthcare team within a facility, it probably means that there is a high chance of exhibiting wrong medication. You know, for example, if people are not discussing, it means that people are not communicating within work, or maybe the communication is there but it's definitely poor. So that would mean that it guarantees poor quality services that is going to be provided among these service providers. Next we have is misdiagnosis. Misdiagnosis happens when it has been poor investigations of a patient's health. And of course, we know that we cannot treat without diagnosing. So we need to first of all identify the problem, and then we can be able to treat. So if misdiagnosis happens, for example, a patient is suffering from typhoid, and then you diagnose it as malaria, definitely it means the patient will be getting treatments for disease that does not actually deserve such treatment. And also we have failure to diagnose. Failure to diagnose is different from misdiagnosing. So misdiagnosing would mean that you make a mistake in correctly identifying the actual origin of the problem. Maybe you did not properly investigate the history of the patient's health, and you did not properly investigate other requirements that is necessary to be identified as part of your findings in your practice, the like of carrying out laboratory tests. Such may definitely lead you to misdiagnosing. But failure to diagnose means that you tend to have done everything that is required to confirm the patient's problem, but then you end up not actually understanding exactly what is the problem or what's wrong with the patients, and definitely such causes you failing completely to say anything about the patient problems, and then either you ignore the patients and the patient dies, or such as a result of such failure. It can be an actions or it can be inactions as well. Another one, we are having delayed diagnosis. Taking too long to identify the patient problem so it can be solved can really lead to death, can really lead to harm, can really leads to physical and psychological damage. So such also is can really lead to medical negligence, and also prescribing wrong medications or wrong doses. Of course, if you misdiagnose, if you fail to diagnose, if you delay with diagnosis, there is a possibility that definitely the patient, you will not be in position to really do well when it comes to giving instruction basically on how drugs should be used, for instance. So at this point, to avoid such kind of negligence, there is need to really understand the patient that you are managing. You understand their age, you understand their weight, so that it can help you to really provide the correct dose that matches with their health conditions. We have prescribed medication without checking patient history for allergies or any other prescription drugs. We understand that many people really don't use, even if people may have the same problems, but not everyone can use the same types of drug. So because many different people have different medical history, people have used different medical medications, people have gone through different experience, and people have different status of allergies. So this in some cases may really causes negligence as a result of treating a patient with what end up causing them problems. Because for example, if a patient is having ulcer and then you provide or you give them the treatment that should not be given to patient with the ulcer, a treatment that either end up boosting ulcers or react against it. And we're also talking about not warning patients about the side effects of medications. The patients deserve to know the effect of their medications that they are taking, so that they should be aware, so that when such things happens, they already know that they expect that before, and such problem can definitely be managed. So if they really know, that would be very easy for them. But in case of you not warning about the side effects, that would cause medical negligence. And we're talking about surgical error. Surgical error happens in, for example, in operations, where at times during the operation something or a piece of whatever it is that has been used, like cotton wood, may be forgotten in the body of the patients, ending up at the end of the day developing into complications. So that has happened or has come as a result of error. And then we talked about anesthesia. Anesthesia error happens especially because we have the anesthesial therapy, a treatment that needs to be given to the patients as the patient is going for operation. So sometimes the dose can be high or too low. So if the dose is too high, it can actually lead to the prolonged unconsciousness of the patients that may end up damaging some part of the body, like other organs, or maybe end up be the one that will kill the patients. And if it is underdosed, it would mean that the patient will actually start responding to external and internal stimuli, yet they're not supposed to know what is happening to them. They should not wake up during operations, or they should not take too long to wake up after the operation. So such need to be understood and properly managed. And also we are having birth injury. Birth injury is actually malpractice or medical negligence, especially if the physicians in charge failed to carry out to embrace and implement their competencies in managing the conditions, whereby maybe they end up causing too much harm to the patients, especially when they are doing cutting and then they overcut, that end up causing more problems, leading to maybe things to do with sepsis or fistula and all that. Those are all medical practice, and birth injury can really cause such. And then we have failure to maintain equipment, and also failure to hire properly trained staff or maybe adequate trained staff, failure to keep a sanitary environment, failure to implement procedures and systems meant to reduce medical errors. So some of these key causes of medical negligence, I have broken them down here, but I'm not going to go through them. You can actually be able to go through them. It is quietly explained for you to understand. When we talked about surgical errors, what does it mean? For example, the operations might have been carried out on the wrong side, leaving of surgical items inside the body, such as sponge that causes infections. Wrong patient surgery, like for example, you're not supposed to be operated, but due to misidentifications, you end up being sent to the theater, yet you didn't have any problem that needs operations. During the operations, and then the doctor or the surgeon damage the organs or some of the nerves. All those are medical negligence, and I would want you to go through it because I've broken some of the key common causes of medical negligence right there, so you can go through them and get more information into details. So we have categories of medical negligence. Medical negligence has been grouped into so far as around 5 stages or groups. One, we have civil negligence. This is when a patient demands monetary compensation for the damage they have suffered. It is going to be regarded as civil negligence. And we have criminal negligence, when the patient or his or relative approaches the police to take actions against what the doctor has done or maybe damages caused to them. Such is regarded as criminal negligence. And then we have comparative negligence. This is seen that it is seen at how much the patient has contributed to the negligence and the damages that are awarded. For example, sometimes negligence can be done. It is because the patient did not cooperate. So it means if you did not cooperate and anything happened, simply means that you contributed into that negligence, and that is defined as comparative. So when it comes to legal procedures, it would mean that they will compare the weight of what the doctor causes and with the weight of the results of what the patient has also causes as a result of their actions or inactions. And then we have a contributory negligence. This is when a patient contributes towards the negligence. It is almost as similar as comparative. And we have corporate negligence. when the damage suffered by the patients may be due to hospitals or nursing homes where receiving treatment from. This means that the problem is not the doctor, the problem is not even the patient, but the problem is the facility, the equipment being used. Maybe it is poor, maybe they whatsoever. But if everything was effective, then that means that we would have all the services intact. But when it happens like that, it means that the facility can be accountable for such. So you will actually ignore this red part, ignore that red part as well. So we have what we are calling Health Insurance Portability and Accountability Act 1996, which is in short referred to as HIPAA. And we are saying that HIPAA is an act passed in 1996, and it is a federal law that sets a national standard to protect medical records and other personal health informations. So the rule define protected informations. So the HIPAA is concerned about how the patient's information can be protected. So it ensures confidentiality of a patient's information throughout the services within the facility. It ensures the effective privacies of the information that the facility is protecting, because remember, this information that we keep is actually not ours, belongs to individuals, patients, and all that. So the implementation of this act is basically to protect the patient's right toward their confidentiality, protecting the patient's right towards the privacy and all that. So the goals and objectives of HIPAA: one is to ensure accountability, confidentiality, integrity, and availability of protected health information, PHI, that creates, receives, maintain, and transmit health informations. Two is also to protect against any reasonably anticipated threats or hazards to the security or integrity of health informations, as well protecting against any reasonable anticipated loss or disclosures of health records. So this look at how do you share the information. You are allowed to share the information, but do you follow the law in disclosing information? So what do we say is about that when it comes to disclosing of information? You must understand the category of the users of the information. Is the users impersonal or a user is personal? If it is one of the two, then you know what to consider. If it is personal, you know that you should consider patient consent before releasing such kind of information. But when it is impersonal, you understand that the information being demanded here does not contain patient's identification details. Therefore, you can actually be able to issue out this information regardless of the consent not being provided. So moving forward, we have the main purpose of HIPAA. Is one, to facilitate privacy of health information, two, providing security of electronic records, and also for administrative simplifications, and then providing quality assurance. So we have HIPAA rules under privacy rules and also security rules. So under privacy rules, HIPAA ensures to provide detailed information for handling and protecting patient personal information, and security to provide regulation that makes sure that confidential records are actually being kept private. Okay, so we have the privacy components here, and the privacy component talks about one, limited access. So limited access would mean that not everyone is accepted to access the patient's physical files or electronic files. So you should consider all the factors that you need to really put limitations toward the access of the medical records within a facility. Normally says that always lock the department, especially if it is out of working hour. Component 2, there is data transfers. What do you consider when you are transferring protected health information? How safety will be the information and who is transmitting the information? And then the patient's right would be able to 24 hours or fully considering a patient's right what are the example of patients' right? Patients have right to access their health information. However, there is a limitation. Patients have a right to give consent before their information can be used by another parties. But remember, it also has limitations. For example, if the person who wants to use the patient's record is coming under legal obligations, or it is being accepted by law, that means that you will actually ignore the patient privacy or whatever rights they have. Their right is limited to such kind of actions. And then finally, we have privacy officer. This is basically the person who is working in the organization as a privacy officer, ensuring that all the rules and policies required for achieving patient privacy are in place. So we have standard for privacy of individually identified health informations. I would say that please leave this part. Okay, leave this part. Leave that part.